Welcome back to the Health Elevated podcast. We love health and wellness in the whole system of the healthcare. We love helping people stick and create healthy habits. And we love our guest who's on today, an awesome guest, Dr. Angelo Giard- Giardino. I'm always afraid I'm going to butcher the name, and I think I got it, but he likes to go by Dr. G, which is what we're going to call him. And boy, oh boy, does he have an awesome resume. He's the Chief Medical Officer at Intermountain Primary Children's Hospital, but he also is professor and chair of the Department of Pediatrics at the University of Utah School of Medicine, and he has just an amazing history of experience. But Dr. G, okay, let's just start right off the bat with this. As a pediatrician, what are you focusing on in terms of health and well-being among kids?
Well, thanks, Rylan, for inviting me and asking that question. And when I think about that, I've been in pediatrics for 40 years, and I've seen kind of the whole process of we in pediatrics understanding that experiences in a kid or a child's early life actually affects their life course and can have significant impact on when, that child grows up and, as they migrate through adulthood to middle age. So, way back in the 1990s, there was some really phenomenal transformational work around adverse childhood experiences. So really difficult things that a kid 2, 3, 4, 5 years old would experience. And that those very negative things, and I'll give you some examples of those, could really then impact their whole life course. And then eventually in their middle age, they would have significant health problems. So those adverse childhood experiences were like significant negative things, like obviously being physically abused or sexually abused or neglected as an infant and a child, but also some more common things like having a serious mental illness in the family or having domestic violence in the home where they were raised, or somebody having a significant substance abuse problem, or even somebody in the immediate family being incarcerated while the kid was small. So those kind of negative experiences created a level of unpredictability in the child's kind of environment. And that lack of predictability really did have significant impacts on how kind of safe they felt. And then that ends up being called trauma, right? And then there's this idea of toxic stress where there's just a level of chaos and kind of confusion and unpredictability in their environment, which then kind of really has impacts on their neural development, like how their brain actually develops. So we did a lot of work in the late 1990s, early 2000s on that. And then people said, well, is there an antidote to the adverse childhood experiences? Like if a kid experiences that, is that then their destiny? Is there anything that you can do? And it turns out there is. And what the science has really shown is that we as pediatricians, family members, community members, child advocates, we can kind of create positive childhood experiences that then counter that adversity. And then that has really positive impacts on the kid's life course. And some of those positive childhood experiences are really kind of common sense, but if a kid can identify at least one adult in their life that they feel is supportive and encouraging and constructive, that actually is incredibly important to that child's development. So frequently, those positive adults are actually the person's parent, or an uncle, or an aunt, or a grandparent. But it can also be a coach. It can be a really great school teacher. It can be somebody in the community in their neighborhood who's just encouraging and positive and, is interested in what they're doing. So as a pediatrician, I'm quite focused on, are we doing things as a group of adults in kids' lives so that they experience some positive childhood experiences. So, that's kind of what I'd love to talk about if you're interested in hearing a little bit more about that.
Yeah, absolutely. Dr. G, I am actually in my local community. I volunteer with a cross country ski group for youth, and it just ended, unfortunately. But it's always a highlight of my winter where it's a couple times a week we get together, and I get to be one of these volunteer coaches for a group of children or youth. And when you were talking, it made me start thinking about this, and what can I do to really, like, as a coach, as someone who's involved with children or youth, what can I do to really be that positive person?
Okay. Yeah, Dave, thank you for that. So this is what I would say, just as kind of some frame setting. It's so important for a developing child, youth, young adolescent to feel like they're welcome and, valued in the environment that they're in. So as a coach, what's so important is to really think a little bit about the environment that you're creating when the kids arrive, when they practice, if they compete, like what kind of environment are they in? So are they in an environment where there may be very high standards, right? So like on sports teams, you tend to want to do well. So it's okay to have high standards. The question is, if they miss the mark, how do you respond to them? Is it an encouraging, challenging, but nurturing response? Or is it one that is demeaning or makes them feel like they're not enough? So I think it's so important to create an environment where the kids feel welcome, respected, that you're in their corner. And in many ways, when you do like qualitative work with kids, as they describe positive experiences, it's really about feeling like the adults in their environment were in their corner, that they were challenged in a way that they knew that you would be alongside of them as you were pushing them to achieve more or set a high goal. So I think what I really encourage is people, particularly in the athletic realm, is to one, be super respectful, make sure that kids feel welcome and that you have to be sensitive to the fact that they're very concerned about their appearance. They're very concerned about how they perform. So any kind of criticism needs to be delivered in a balanced way so that they know you value them. You just want them to either work harder or practice more or think a little bit more intentionally about the task at hand. So as long as you can preserve their sense that you're in their corner, you can really drive them to perform at a very high level.
So does the duration of these interactions matter in the research that you've seen? So I'm asking you, like, the group that I work with, we're working with for as little as 2 months out of the year and may not see the same kids come back the next year. Is 2 months, just a 2 month interaction a couple times a week, is that enough to start setting these standards?
Absolutely. So, one of the things we say in pediatrics, Dave, is that you never know when you're creating a memory. And, kids, when they're, when we talk with kids, who've now grown up and then they reflect back, there are some really, really momentous conversations or experiences that they've had that really were singular, but it was a time when somebody really communicated that they were valued, they were welcome, and that the person talking to them really saw in them a capability or a commitment or an aptitude. And that was just inspiring to them. So quite frankly, 2 months of a set of experiences where you're encouraging and balancing the challenge with the nurture, that's plenty to create a really strong memory and a set of experiences that that kid will feel like, hey, there was somebody in my life that saw something good in me and they really encouraged me to develop it or be intentional about it or to really explore some additional opportunities. So yeah, I mean that 2 months with kids is kind of a gift. That would be wonderful. And you can create an environment where the kid thinks that you're valuing them. And again, they will carry that with them. So you never know when you're creating a memory.
I really like that. You never know when you're creating memory. I think of my own kids, of course, they always seem to remember everything I don't want them
Yep.
to. So that seems to be the case there. I never seem to remember what I do tell them what I do want them to remember. But yeah, that's interesting. That's very interesting. You never know when you're creating a memory. So I guess in that same vein, anyone can look for those opportunities in day-to-day life, even in just standard encounters in the community. It doesn't even have to be a 2-month venture. It doesn't even have to be a 1-month venture. Just being able to reach out and compliment a kid could be enough to create a positive interaction. Obviously not as
Absolutely.
powerful, but yeah.
Absolutely. It's kind of this idea of, you know, thinking about the energy that you bring to a situation. And, if you have an opportunity, if you're in a position as an adult in an environment where there's kids around, are you bringing some positive energy to that interaction? And are you using the time that you have, no matter how limited it is, to identify some positive or some constructive elements to that situation? And then are you letting the kids know that you're glad that they're there? That's plenty. That's a positive childhood experience. And then as a community, I had this experience a few years ago and it really came home to me. So one of the positive childhood experiences that some researchers have looked at is kind of like civic involvement and civic pride. So a few years ago, I had the opportunity to be in New York City over the summer. And, where I was staying in Midtown Manhattan, and a number of the streets were closed off and they were gonna have a parade. And so I asked some people what was going on. And they said it's Dominican Day. And what I started to see over the course of that day is that a number of families started arriving. They all had like little Dominican Republic flags. There were booths where you could get food and there was some music. And then I started to see the kids with their parents and, the adult people in their life. And that really kind of hit home. Like those kids were getting a memory that Manhattan was honoring their ethnicity, and they had flags and they saw some of the elements that defined their ethnicity and their nation of origin. And that's an example of like civic pride. So like they developed the memory that where their parents were from was valued, and they got to experience that like a city would shut down a few streets, that people would develop a parade, all to honor that element of their identity. And those are the string of positive experiences we have to be about, so that kids on average will bump into some positive constructive experiences rather than having to stay with any kind of adversity that they may have been exposed to.
Interesting. So, I mean, obviously, I can't influence what happens inside the home of every home in my community, but I can influence what starts to happen out in the community. Talk to me, like, what realistically can these positive childhood experiences, can a regular pattern, a strong supportive community, can that begin to overcome the detriment and the problems that are associated with adverse childhood experiences?
It's definitely the beginning of that. Now, obviously, if you think about that, the making sure that there are these positive childhood experiences is one part of the recipe. Then the other part of the recipe would be, depending on what the kids' needs are there other services and supports that are also in place so that they get the help that they need? And, whenever we talk about kids, like a natural place to go is schools. So at the school, are there services and supports for the kid if they're having kind of a significant need, one that would be maybe like more clinically based? So I would say, are the schools adopting a supportive, safe, nurturing environment approach? And, you had already mentioned this. are there adequate recreational opportunities? Because the work of childhood is play. Are there parks and are there sports fields that kids can get access to? And are there some, volunteer groups so that if you want to learn how to play baseball or basketball or, in this environment in Utah, if you want to do some trail runs or whatever, like, are there opportunities both at the school and on the recreational side for that kid to have some of those needs met? In addition to then the adults in their environment being positive and constructive towards them.
So what you're describing, it seems like it very much fits along the lines of the Maslow hierarchy of needs. So as those most basic needs are met, then those higher level needs can be met. And that as we start to meet those needs more and more fully, appropriately for the needs of the child, that can then start to have a rescue effect for the potential of adverse childhood circumstances.
Absolutely. And you're really picking up on that concept, right, Dave? So like universally, frankly, kids should bump into adults regularly who are complimentary and constructive and encouraging. So everybody needs that. And then some kids are a little bit at higher risk because of some adversity. So they need a little extra dosing of that, if you will. And then some kids who have had a significant adversity, they need to make sure that, like services and supports are available to them. So that highest level of adversity needs, almost like clinical involvement. But everybody needs adults in their environment who, see their value and compliment them and express an interest in seeing them do well.
And then I guess from the perspective of a community member, you never know what that child's needs are when you bump into them in the grocery store. And you never know when you're going to create a memory, and that you never know what the situation of the child is. Puts quite a huge responsibility on each and every one of us to treat children with tremendous respect and kindness, doesn't it?
Yeah, well, there was this expression that we used to use a lot in the 1990s and 2000s. It takes a village. And that's really true because, if you think of a typical day, there's a lot of interactions and there's a lot of opportunity to put some positive energy into the world. And kids pick up on that. So, like, I think, like for me, like as a pediatrician, kids notice how their parents are treated when they arrive for care. So, do we value their parents' time? So when they show up to the desk, do we do the intake quickly so that we don't waste anybody's time? And if you're sitting in the waiting room, do we have systems in place so that you get processed quickly and get back to the room and then, the parent and the kid can go off on their day. So kids notice if their parents are treated respectfully or not. And those are some memories that get created. So you have responsibility for all of us to think about if there's kids in our environment, what messages, both directly and indirectly, are we putting out there so that they know that, we live in a civil society and their parents are respected and the kids valued. Like, are you contributing to that no matter what your role is in in that environment?
Something you said brought up a topic in my mind. You talked about how like the community has this huge responsibility and it takes a village to raise a child. So in our current day and age with our current technology base, we see the rise of social media and social media really becoming a massive influence in everyone's life. And there's been studies that have suggested potential negative links between social media use and child well-being. And there's also been some other studies that have shown that the use of social media tends to, it's got another correct word here, but it's almost diminishing the immediate community around us because people are relying on these digital associations and digital social interactions rather than actual interactions within their community. And I know this is probably a much larger topic than we have time for today, but from a very high level, what are your thoughts on the ability of social media, or perhaps the inability of social media, to start to be that community or that village that can help raise a child?
So I think, a couple things. And like you said, this is like an enormous topic, but the American Academy of Pediatrics really encourages us as pediatricians to talk to families about kind of, I think they call it like a social media usage plan that they really encourage parents to think through. So in fact, it's actually available on the American Academy of Pediatrics website. If you go to, aap.org and look up a social media usage plan. And what it does is it asks the parents, and then depending on the age of the kid can participate in this. But like, what do we want to get from our social media use? And what commitments are we going to make? So like, are there times of the day where we want to focus more on face-to-face interactions and we'll agree, maybe like at the dinner table, we won't have our cell phones with us. Or if we're going to engage in certain social media platforms to communicate digitally, are we going to commit to using respectful language? And if we're going to comment on somebody's post, are we going to commit to, thinking about the impact of what we say in the social media posting and like how might that be experienced by the other person? So I think, social media is a way of interacting. And I think it's important to have some guardrails around it. And, in light of our conversation here, being really committed to being careful about what you say and how you say it, even though it's digital and you're not specifically speaking to the person's going to consume it as if you did say it to them. So are you really thinking about the impact of your behavior on that platform? And
You
that
know,
really does have a significant impact on the kids.
yeah, you never know when your posting on social media could create a memory for someone else.
Exactly.
Yeah,
Exactly. Well,
I really
well,
like that. I apologize for bringing such a big topic, but you did a very good job of it up within our own context here. I really, we're just about out of time here. I have really enjoyed this conversation. I'm a parent. I have young kids at home. I try to be engaged in my local community, and this has given me a lot to think about. I wrote down that social media plan from the American Association of Pediatrics, and I'm going to read it. This has given me a lot to think about. Dr. G, but this has been a fantastic conversation. We're so grateful to have you on today to share your expertise. I hope as many people can be impacted by this conversation in the same way that I have. I think that can help us grow healthier and stronger communities around us and prepare the future generations for success. Thank you very much.
thanks, David. Just what I would just ask the listeners, like today and tomorrow, if you see a kid, go say something encouraging to them. You may create a memory that they carry with them for a lifetime.